Hi everybody, I'm Dr. Chris Schroeder and I wanted to do an episode of what I'd like to call Common Sense. I wanted to touch base with our common prescription medications that are prescribed every day, and so I thought I'd start with the number one prescribed medication in the country, which is Synthroid. We prescribe 21.5 million prescriptions of Synthroid in our country per year. And I always want people, if they're taking a medication, the number one thing you need to do is know what the side effects are. So if you're suffering from one of these side effects, you realize that it's coming from the medication and not another issue. So some of the side effects of Synthroid are a rapid and irregular heartbeat. We can have chest pain, muscle weakness, shortness of breath, nervousness, irritability, sleeplessness, tremors, change in your appetite, weight loss, hair loss, vomiting, diarrhea, excessive sweating, inability to tolerate heat, fever, impaired fertility, decreased bone density, change in your menstrual cycle, leg cramps, and headaches. These are all things that can be caused by the medication. Now, when you think of Synthroid, usually people have hypothyroidism when they are taking a Synthroid medication. Now, when we understand the thyroid, we know the pituitary has to be creating enough TSH to turn the thyroid on. So if we're taking Synthroid, the thyroid isn't responding to that TSH. And so when we look at the panel they run to decide if the thyroid is working properly, it tests the TSH, the T3 and T4 levels, and the T3 and T4 come from the thyroid. Now, what I don't understand is why we don't test other things that the thyroid needs to function properly, such as iron and iodine, two very simple elements that we need in our system for our thyroid to work properly. So if we test your iron and iodine and those are irregular, we could use an iron or iodine supplement instead of taking Synthroid for the rest of your life. So it's a very simple, basic test. It's a finger stick test. We can do it in about 10 minutes in our office, and it costs about $20. So if you're taking Synthroid, I would strongly suggest that you at least get your iron and iodine tested. If you have any further questions, please contact our office. My email is familychirodoc@yahoo.com. Thank you. Have a wonderful day.